people who are literally living in the ashes of these crisis situations, and the foundation has come in and lended a hand and pulled them out of that.
I just knew that my world was changing right then, and I just didn't know what to do.
They trust where their money is going, because that trust is built through action, and you see the actions of Community Health Foundation in the facility and in the community.
We're more of a family here than we are co-workers. She says it's not what you give, it's that you give. The funeral home was called, and you know, we don't have the money to even go get his body or his ashes. We were going to have him cremated.
The Community Health Foundation began almost a decade ago now. It's an outgrowth of the culture of our healthcare organization. Many, many years ago, one of the founding kind of parts of our organization was we believed of caring for our own and caring for the community. We saw as a healthcare organization the need to care for our associates, and what we observed was associates seeing the need to care for other associates. And from that beginning, we formalized it into a program, formed the foundation, and today it's the means by which our associates are able to care for each other in an organized approach. And Community Health Foundation is our outward reflection of our belief system, and it's who we are. And so I see it as a ministry. It's service to the community, it's service to our associates, and it's about service. And ultimately, that's what we are, a service organization, and this is the greatest expression we can have of that.
About a year ago, my father started getting sick and forgetful and just acting different, and his doctor had said that he was probably in the beginning stages of Alzheimer's, and he was he had CAT scans, and it showed that he was having many strokes and just some things. He was starting to go downhill, and we knew that. But then the Sunday after Thanksgiving this past year, he walked outside in the rain and the dark and committed suicide. And to say our family was devastated is just a gross understatement. The social services director here at Gordon, she's also my friend, and she was asking how we were doing, and I said, you know, I don't know what we're going to do. I said, the funeral home is called, and you know, we don't have the money to even go get his body or his ashes. We were going to have him cremated, and you know, I said, I don't know what we're going to do. And she said, would you like to fill out an application, you know, for Community Health Foundation to see if they can help you? That day she called me and she said, don't worry about a thing. She said, they're going to help you. And she said, I don't know how much, you know, but she said, don't worry, because they are going to help you. And we were just, you know, my family just, you know, because there's 4 of us that work here. My mother's a nurse here. My sister's a CNA. My nephew is floor technician. My grandmother even sits with patients here. And, you know, but our family is much bigger than that. And so, you know, they didn't just minister to us that work here. They ministered to my whole family. It was tremendous, because then we were able to take care of, we could go get him, you know. We could go get him, bring him home, and deal with the shock and the grief, you know, and take care of each other, because we had that taken care of. And it was, I can't even say what that meant to my family. Tommy Dobbins came to the center and he talked to me and he cried with me, you know, and I told him, and I always say that it meant, the money meant everything, but you know, he could have sent the money and a card, you know, but he came and he sat there and talked to me and he cried with me. He cried with me. He called my mother, you know, he talked to my sister and my nephew, you know, and the fact that he cared when he didn't have to. You know, Community Health Foundation is his job. He didn't have to care like that, but he cared, you know, and that was more than the money even.
The opportunity that I have to do this job, to touch people at the point in their life when they maybe feel alone and like nobody cares, to show them that there are a lot of people that care for them, to tell them there are hundreds of people praying for them, that thousands of people have given that make this assistance possible to help them. We try to move people from where they are now to a position where they could be, and we call it now to wow. And we try to take people from where they are to where they could be if they had just a little bit of help.
And they helped me pay my light bill, get food in the house, my gas bill, my water bill, and I have one other bill, and they helped me with that. And I really thank them for that, because it really helped me, you know, because I didn't know which way to turn at the time, you know. So that was a blessing. It was a big blessing.
People need to help people. There's something about being a human being that is created, I think, in the image of our Creator that drives us to help folks. Most people don't know how to go about it, so they don't do as much of it as they'd like to do. But what I found is that if you show people how they can help someone and make a real difference in someone else's life, and they can do it without harming their life, and they can join with other people to get it done, I found they're a lot more willing to do it than I thought they would be. I've been amazed at how willing people are to help other people.
Yeah, and people don't realize that a foundation like this helps people all over the state of Georgia out of situations. It's just a blessing to have something to belong to and knowing that you're helping people.
I have the privilege of introducing our new associates to the Community Health Foundation program, which consists of two funds, the annual fund and the Hearts to Hands program. When someone requests assistance, the foundation makes payments directly to whomever the money is owed. For instance, if someone is asking for assistance with a mortgage payment or a car payment or a utility bill, they submit that bill and Community Health Foundation then makes that payment.
We are a crisis assistance program. We're not a financial assistance program. And sometimes people get a little confused between the two. When we say crisis assistance, we have to show an unavoidable crisis that has occurred. Our goal is to help people long term. So if they're simply over budgeted or they just have more bills than money, that may not be something that will qualify for our program. Really what we were set up for was to help people in times of crisis.
My son had recently lost his job, and we did not have a second vehicle. And one morning I got up and my car died on me, and I was just devastated. Without my car, I knew I couldn't go to work. Without my car, I knew I could not continue to work at Southland. I just knew that my world was changing right then, and I just didn't know what to do.
Community Health Foundation helps out with the idea that that one-time assistance is going to help them get over a hump, and then they'll be able to pick up and carry on from that point.
It is a good feeling to be a part of that, not just as an administrator, but as any associate can be, because we all, let's face it, are caregivers. And to care for each other in that way in our own times of need is amazing.
We had another associate who had come to me. She was living in her car because she had shared an apartment with her grandmother who had a stroke, was hospitalized, and unable to return home. When her grandmother discontinued rent payments, of course our associate had nowhere to live. And so what Community Health Foundation did, they put her up in a hotel for a couple of nights. She found an apartment. They paid her security deposit, got her utilities turned on, and once that was taken care of, she was okay to continue to handle the expenses on her own. So they really helped her through a rough time. It was emotional because her grandmother was so ill, and she found herself basically homeless. And so without Community Health Foundation, I really don't know what might have happened to her.
We don't need to know someone's background. We don't need to know, someone's thoughts about politics. We don't need to know what church they go to. We don't ask those kinds of questions. We ask, how are you hurting? How can we help you? And then we try to see if the best way we can help you. And sometimes that's to say, okay, we can do this for you. Sometimes to say we can't do this, but we can do this. And we think this might be better. That's what we're about. And that's why we do what we do.
Associates can sign up and they decide what they want to give and to which funds they want to contribute. They can contribute to both, or they can choose the annual fund, which helps associates as well as community projects, or they might want to give to Hearts to Hands, which is in place to help associates only. Another thing that's wonderful about the program is that all money donated by associates is only used to help individuals. None of the money contributed is used to run the program, to pay the salaries, or any of the costs incurred in running that program.
We don't want anyone to give out of guilt. We don't want anyone to give out of pressure. We want it to be totally voluntary. But we want people to give because they realize that it'll make a difference not only in someone else's life, but it'll make a difference in their life, and it'll make a difference in the place where they work.
Each individual can determine what they want to contribute. It can be anything from $1, $5, $10, whatever someone feels comfortable with and led to contribute.
The foundation has helped thousands of people, thousands, in the 8 years that I have been here, and the difference that it has made in these people's lives is absolutely phenomenal. And that's why I give, and that's why I believe in what I do every day.
A wise man once said, "Do unto others as you would have them do unto you." You may notice that I wear a boomerang almost every day. And the boomerang is a reminder for me that whatever I throw out in life is coming back to me. Community Health Foundation is a way to throw out good things. And it has brought good things back to our organization and to many of the people who are working in our organization. That's why we think it's important for all of our new associates to see this orientation video, because it is a reminder that, first of all, Community Health Foundation exists, and it exists for you. It's to help you in your time of need. If you find yourself in a situation where you feel like you need the foundation's help, please ask your supervisor or their supervisor to give you an application. Fill it out and turn it in, and we'll work with you, and I promise we'll help you if your need qualifies. The second thing is, it does you good to help other people. You know that already. You help people all the time. But one of the things you might not know is, how can I help people with my money? And I don't make enough money to really make a difference, but it doesn't take a lot of money. We have people who give $2 or $5 every time they get paid. We need your help to keep doing this, to ensure that it can continue beyond what we can even think or imagine. To be able to help like that, we need our new associates to join us in making contributions. It's not hard to do. In your packet, there's an information form, or really it's a contribution form, and it gives us everything we need to start taking that $1, $2, $5 from your payroll check. If you would print your name here, tell us when you want to begin that money, when you want the money to begin coming out of your check, and tell us how much you want to give, whether it's $2 or $5. It really doesn't matter. What matters is that everyone gives something. And then tell us where you want the money to go. If you'd like for it just to help associates only, put it in the Hearts to Hands. If you'd like to help non-associates, put it in the annual fund. If you'd like to do both, split it up and put some in each place. And then again, just list the total you want deducted each time you get paid and sign it and turn it in. That's all there is to it. We hope you'll help us. It makes a huge difference in the lives of many people every week. And we pray that this job that you're beginning will be a really, really significant step for you, and it'll be beneficial and meaningful for you for years to come. Thank you, and welcome to the organization.